So has anyone gotten up and you feel so terrible that just the thought of going through another day makes you want to shoot yourself in the face? Well, that is what depression is like. And I know this because I've dealt with it extensively, and I have some scars on my left arm from that period. And I did some research, and according to the Centers for Disease Control, 1 out of 10 adults actually suffer from some form of depression, which is a good chunk of people. And so it is really important to kind of know what the cause is that may result in depression, because not a lot of people are too familiar with that, and also the symptoms and potential treatment options if you're ever diagnosed with depression. And one such cause are biologically related, and one of those are genetics. And according to a professor of psychology by the name of Tarleton, there are genes that are pretty much present that code for proteins that cause and predispose someone for certain illnesses. And, well, the problem with that is that it's not 100% fully proven with undeniable facts. So just because you may have some genes that are maybe predisposed, that doesn't mean that you'll get any illness or have depression. And additionally, another biological cause are neurotransmitters. And for those of you who don't know what neurotransmitters are, they're pretty much little capsules in our bodies that carry chemical messages to our brain, such like hormones and stuff like that. And according to neurological researchers Warner and Convenas, well, a good chunk of patients with depression also reportedly have hyperactive neurotransmitters, and that causes a chemical imbalance which kind of helps lead to depression. And besides biological causes, there are also life events that can cause depression, such as an example is stress. And there's actually a research study done by a PhD of psychology by the name of Hammond and her colleagues that showed that women with acute stress and chronic stress are more susceptible to major depressive episodes as well. And other life events include death in the family, what you would call losing your job, and other stuff as well. And they can combine with biological causes that give one nasty depression. And it's not only know kind of some of the potential causes, it's really important to know symptoms as well. So just in case you're dealing with it, you kind of at least sort of have an idea what may be the problem. And according from my experience and to some information provided by Mayo Clinic, some symptoms of depression are, well, fatigue, what you call loss of appetite, irritability, suicide ideation, self-harm, complete and total hopelessness, and there's many, many, many more. And unfortunately, just having one of these symptoms is bad enough, but you don't need to have all of them, because there's a wide variety of them, to be diagnosed with depression. And, well, once you're kind of diagnosed or have the symptoms present, the most important step comes, and it's getting treatment and knowing your treatment options especially. And one treatment option are antidepressants. And antidepressants actually work to reduce the hyperactivity of neurotransmitters. And according to Warner and Convenas, the neurological researchers, it's actually done by preventing the reuptake of neurotransmitters by neurons. And in simpler terms, we have neurons in our body that kind of pass these neurotransmitters along to write the message, and they have to go through spaces in between these neurons. And antidepressants prevent those neurons from being taken up by a neuron, and it reduces the hyperactivity of these certain antidepressants, or these certain neurotransmitters, and it kind of brings balance and helps with depression. And another option is also psychotherapy, and there's numerous types of psychotherapy. There's cognitive behavior therapy, which is learning behaviors and skills to deal with certain problems so you don't slip into a depression. And there's also psychoanalysis, which is essentially talking it out and trying to get to the root of your depression. And there's also, in extreme cases, electroconvulsive therapy, which is kind of attaching electrodes to your head and shocking you. That's in extreme cases. And, well, the prognosis for depression after getting some treatments, it varies with people. If two different people will respond differently to treatment, and it varies along with the chance for relapse as well. It varies with person to person, and Well, yeah, it varies, and it also depends on the severity of your depression as well. And so, in conclusion, you know, a lot of people deal with depression, and speaking from personal experience, I had no idea what the hell was wrong with me, and everyone missed it, including myself. And unfortunately, I started self-harming, and I didn't get treatment till really, really, really late. And well, that's why it's so important to know your symptoms so you kind of have an idea and to get treatment immediately, because so unfortunately some permanent damage is done, as evidenced by these scars. And a lot of people deal with it, and you may never know if someone you know may be dealing with it as well. So thank you very much.